prevention is not something that should be done when people already have periodontitis. And this is really an issue. It's something that is a misuse of preventive measures.
Periodontitis is a chronic disease that of course is triggered by bacteria, but is really modulated by the host. And therefore we need to understand what is the risk of the specific host in order to be efficient in prevention.
We call the first PMPR. It means that we're going to remove the biofilm, disperse it from the neck around the teeth, and we extend submarginally as far as it is needed to get to the bottom of the sulcus. We are including removal of plaque and removal of calculus.
Secondary prevention means all the preventive measures that we have to implement and also the patient needs to implement after being treated of periodontitis.
We have to make sure that they don't get periodontitis again and that the periodontitis does not progress.
PMPR becomes PMPR plus. So it's an upscaled version of the intervention that also includes removal of the deposits, dispersion of the biofilm, all the way to the bottom of residual shallow pockets that may still be present in this situation.
From the patient personal point of view, things like traumatic toothbrushing, halitosis, or dentinal hypersensitivity are very important issues that affect their daily life. So providing good advices, providing important evidence on efficacy of specific agents, I think is important not only for the dental community but also for the public community.
We found very little evidence, in fact we found no evidence, that the use of dental floss in patients who have gingivitis or periodontitis confers any benefit whatsoever in terms of efficacy in patients who have some kind of space between their teeth. And it's very clear that in that situation the use of these small interdental brushes, the mini interdental brushes or the bottle top interdental brushes are effective when used as an adjunct in addition to mechanical cleaning. That is not to say that floss doesn't have some role to play, but the only role it would appear to have to play is where we have no gaps between the teeth and we have a healthy situation. And in that situation it may not be possible to use these other devices. And where that happens, then floss is something that we would suggest is worth using. Even though we actually don't have any evidence, that doesn't mean it doesn't work. We just don't have the studies to prove that it works in that healthy situation. Those power brushes appear to be more effective at removing plaque than manual toothbrushes, significantly more effective.